Global shifts in US foreign aid, especially the freeze on funding from the once flagship President's Emergency Plan for AIDS Relief, or PEPFAR, have sent shockwaves through health systems across sub-Saharan Africa. South Africa, which is home to around 8 million people living with HIV, and the region's largest treatment program, has seen critical HIV prevention and care services disrupted as US support was paused and renegotiated at much lower levels. After months of uncertainty and temporary bridge plan to sustain some services into early 2026, experts warn that the big picture remains fragile and the risk of reversed gains is real. Well, today we're joined by Zohakiy Mbi-Njifor, who is a co-founder and CEO of the Endless Life Group, to unpack what these shifts mean for health systems in South Africa and beyond. Thank you very much indeed for joining us, and welcome to the program. Hello, Zohakiy, can you hear me?
Thank you very much. Can you hear me?
I can hear you now. Fantastic. Thanks so much for joining us. All right, Zohakiy, I'm going to assume that you can hear me. Many listeners may not know what PEPFAR, may not know PEPFAR by name. And for listeners across the continent, briefly explain what PEPFAR is and why it has mattered so much for HIV treatment and prevention.
Thank you very much, Peter. Well, PEPFAR is what we call the US President Emergency Fund for AIDS Relief, which has been running for over 2 decades globally, funding the reduction of HIV/AIDS prevalence and prevention, as well as treatment and care globally in many development and low-income countries. That's what PEPFAR is. It's a Senate-approved fund that was instituted to aid developing countries to address the HIV/AIDS pandemic.
So we saw US aid policy shift rapidly in 2025, and that paused PEPFAR. What impact has this funding disruption already had on HIV services in South Africa and other countries?
Well, we see the impact vary globally from countries to country. For countries where health budgets really do not exist, you find that the impact is more severe. In South Africa, the impact has varied because the PEPFAR-funded HIV program funded part of our treatment and care, and also funded aspects of most of our prevention work in South Africa. We do know that South Africa does invest well in its healthcare. However, a component of our health funding was supported hugely by the US PEPFAR funding into the country, up until about 4 to 8% of it. And so with the cut in funding, you do find that aspects of HIV prevention has suffered dismally, and a lot of organizations have had to close shop because they no longer have funding to provide HIV prevention services to the population. Some components of treatment and care were affected, components of TB treatment affected across the country, and also issues of healthcare workers. You know, the PEPFAR funded programs to support health workers across the country significantly in certain parts of the district, right up with technical staff. So there's been a lot of disruption in areas where the PEPFAR funding went into in South Africa. But this does not compare to what we see in other countries that largely are donor reliant.
How prepared are health systems to absorb those services if external funding continues to fluctuate in the way that we're seeing?
Well, South African health system, by virtue of its name, is a health system. It is relatively strong compared to its counterparts in Africa. Prepared, I wouldn't say we were. I don't think the health system was prepared for the to lose that significant. I mean, we're talking about 750 odd something million rand, that was lost to funding in South Africa. So I don't think we're prepared for that kind of a cut, and so abruptly, if I may say. And so, yes, I don't think any system is ever prepared for that kind of a shock. And so one of the things that the health department, I am aware, is really focusing on is making that system more resilient, to ensure that if should there be future cuts, um, the system is able to absorb the shortfall. And that's what I think, it's really coming to the forefront with what the Department of Health and the government of South Africa is putting in place to support and elevate what the challenges we see and even foresee with the withdrawal of the PEPFAR funding to South Africa.
Are we seeing reversals of gains that had been made over time as a result of this?
Absolutely. Well, I mean, we've seen some reversal of gain, but I think that the Ministry of Health is playing significant catch up. We've seen some reversal in treatment and care, to loss to what we call loss to tracking. Those that are on treatment, loss to tracking in the period that some NGOs had to close down their programs. However, NGOs work very collaboratively in South Africa, and I think South Africa is a slightly different health environment because it is not solely dependent on donor funding. And we've seen in that collaboration, because in any case, with the PEPFAR funding, we've always had 2 decades of PEPFAR treatment and care partners working very closely with the South African government. With clinics, they work hand to hand with clinics in different districts, in wards. They work hand to hand with the National Department of Health. So where there has been reversal of gains, they've been marginal. And so the government has been able to quickly absorb, quickly start pulling those clients back or patients back into the public sector. And I think with time, especially with the efforts that we see the South African government putting forth, availing resources to support and elevate some of the pressure on the healthcare system, we do think that the whole target, that what we call the 95-95 target, will be restored. We are very well on track. However, we need to mobilize areas which are struggling, for example, support with healthcare workers and other support services that needs to kick in to see that we fully achieve those targets as the years go by.
I suppose looking ahead, 2026, what concrete steps do you think national and regional levels need to be put into place to safeguard critical health programs and build sustainable systems going forward?
Well, I think, we saw in South Africa, we do have, we are not short of systems, we're not short of policies. Most of what we need to do going into the future is really prioritization, right? So we need to reorder our priorities. And I think a lot of focus needs to be on protecting core services into the community. So we need to see community services and core direct services that are patient-facing, patient services restored fully. Okay, so I think that is really what the government is prioritizing in this season, which is absolutely correct, because we need to maintain people on treatment, maintain people on care and support, as well as building what we call sustainable domestic health financing. Sort of intermittent support would not work to build a resilient system. So
Zohakiy, we're going to have to leave it there, unfortunately. But thank you so much indeed for your enlightening thoughts on this situation. Thanks so much for your time.
Thank you, Peter.